everyone. In the last lecture, we had discussed about the antipsychotic drugs, and we had discussed what is psychosis, what is neurosis, what is the etiology of the schizophrenia, vis-a-vis we had discussed the dopamine hypothesis, glutamate hypothesis, and serotonin hypothesis, and we had discussed the classification of antipsychotic drugs. So in the classification, we had discussed that typical antipsychotic drugs, they have a D2 blocking action more than 5-HT2 blocking action, and atypicals have a D2 blocking action which is less than 5-HT blocking action, or 5 D2 blockade by 5-HT blockade is less than 1 in case of atypical, and D2 blockade divided by 5-HT blockade is greater than 1 for typical drugs. And further, we had classified the typical antipsychotics into phenothiazines like the having aliphatic side chains, chlorpromazine, triflupromazine, having a piperidine side chain like pyridazine. And we had remembered that pyridazine has the weak D2 blocking action and the least risk of extrapyramidal symptoms. Then we had discussed about uh, thiazanthines, which are thiazixine and flupentixol, butyrophenones, which are haloperidol, droperidol, trifluperidol, and miscellaneous drugs like pymoside, loxapine, and molindol. Then coming to the atypical antipsychotics, which have low affinity for the D2 receptors, or the D2 blockade by 5-HT blockade is less than 1. And these are the drugs which end with pin, or those end with dun, or which end with prazoles. So the drugs which are ending with pin are clozapine, olanzapine, quetiapine, and asenapine. Those which end with dun are paliperidone, iloperidone, and ziprasidone. Then the drugs which ends with prazoles are eripiprazoles and brexpiprazole. Now in this lectures we will discuss what are the uses of the antipsychotic drugs and what are the side effects of particular antipsychotic drugs. So what are the uses? So the antipsychotic drugs are used first and foremost for treating the positive symptoms of schizophrenia, and some of these are also used for nausea, vomiting, like flucloperazine and amisulfuride. For GERD, levosulfuride is used. For hiccups, chlorpromazine is used. For tic disorder, haloperidol is used. However, the drug of choice for tic disorder is tetrabenazine. Okay, the drug of choice is tetrabenazine, and also the other two drugs which are used in tic disorder is clonidine and guanfacine. Then in neuroleptic analgesia and anesthesia, a drug named droperidol is used. In Huntington's chorea, we can use haloperidol or tetrabenazine. Then coming to the adverse effects. So adverse effect can be hyperprolactinemia because there is D2 blockade, and there can be weight gain with these drugs. The alpha blockade of these drugs causes hypotension. Then muscarinic block or acetylcholine blockade of the typical antipsychotic causes blurring of visions and dry mouth. These all things are the side effects of typical antipsychotics. The side effects of typical antipsychotic can be due to D2 blockade, can be hyperprolactinemia, they can be weight gain, alpha blockade leading to hypotension, and histamine blockade leading to sedation. Now, due to the D2 blockade, further, there is extrapyramidal symptoms, which can be classified on the basis of their onset. So, the first to be caused is acute dystonia, and next is drug-induced Parkinsonism. So, both this acute dystonia and drug-induced Parkinsonism, the drug of choice for the treatment of these two is benzaxol, that is centrally acting anticholinergic. Then coming to the akathisia, which occurs at 5 to 60 days, and the drug of choice is propranolol. Then tardive dyskinesia, which occurs of months to year of antipsychotic uses. That is withdrawal of chronic antipsychotic use. So there is chronic D2 blockade in case of antipsychotic. If the typical antipsychotic is used for a chronic period of time and if there is withdrawal, then it has already led to the supersensitivity of the D2 receptors. So what is the drug of choice? The drug of choice is BMAT2 inhibitors, that is valbenazine, and benhexol is contraindicated in this case. Another side effect of this typical antipsychotics is neuroleptic malignant syndrome, and the drug of choice in this is dantrolene. Then perioral tumors also are caused, which takes months to years to develop. Now coming to the individual drugs. So the side effect of atypical drugs are mainly uh, increase in glucose and increase in lipids and weight gain and insulin resistance. And the extrapyramidal symptoms are less with the atypical antipsychotics. Now, lipodystrophy also occurs with clozapine and olanzapine. Then coming to the drug clozapine, it is the drug of choice in case of resistant schizophrenia. And what are the adverse effects? So we need to remember that the dose-dependent adverse effect in case of clozapine is seizures, and the dose-independent adverse effect is agranulocytosis. Also, clozapine gives rise to a syndrome which is known as wet pillow syndrome, and that is due to the alpha-2 blockade and the stimulation of M4 receptors. And this wet pillow syndrome is the result of cyalloria. So, what is cyalloria? That is secretion of saliva is increased. So that results in the wet pillow. When the person sleeps, then the pillow becomes wet, and that is called wet pillow syndrome. Apart from this, clozapine can also cause myocarditis and seizures. Coming to the quetiapine. So quetiapine can cause cataract, and we can remember by the mnemonic QC for quality control. Same as quetiapine, cataract. Now ziprasidone, it can cause torsades de pointes, and risperidone has got maximum D2 blocking among the atypicals, and therefore it has got maximum potency to cause the extrapyramidal symptoms among the atypicals, and it is least sedative. Coming to the another drug, that is pimavanserin. This pimavanserin is used for Parkinsonism induced mental anomalies. So you can remember it by the name itself, PIMA. It stands for Parkinsonism induced mental anomalies. Okay, and it acts by blocking 5-HT2 receptor. So this was all about the antipsychotic drugs in a nutshell. So what are the uses? The uses are for positive symptoms of schizophrenia, for nausea, vomiting, for tic disorder, for neuroleptic anesthesia and analgesia, and Huntington's chorea. And the drug of choice for tic disorder is tetrabenazine, and haloperidol can be used, clonidine and guaifenesin can be used. Then in Huntington's chorea, haloperidol and tetrabenazine can be used, which is a VMAT2 inhibitor. And next, coming to the adverse effect of typicals are hyperprolactinemia, weight gain, alpha blockade can result in hypotension, and muscarinic effect or muscarinic block will result in blurring of vision and dry mouth, and histamine blockade will result in sedation. Further, the extrapyramidal symptoms are due to D2 blockade, which can be classified as acute dystonia, drug-induced Parkinsonism, akathisia, and tardive dyskinesia. So, acute dystonia, the drug of choice is benhexol, and same is the case of drug-induced Parkinsonism. Then, akathisia, the drug of choice is propranolol, and the tardive dyskinesia, drug of choice is valbenazine. Next, coming to the side effects of the antipsychotic drug, atypical antipsychotics. So these have weight gain, insulin resistance, and increase in glucose and lipids. Then clozapine, important thing is to remember is that it is drug of choice for resistant schizophrenia, and the adverse effect is agranulocytosis, which is dose independent, and seizures, which is dose dependent. Quetiapine can cause cancer, ziprasidone can cause dorsal pointis, and risperidone has got highest D2 blockade among the atypicals. That is why it has got the highest extrapyramidal symptoms risk, and it is least sedating. Another drug, that is pimavanserin, is used in Parkinsonism-induced mental anomalies. So that was all about antipsychotic drugs. Thank you.